If you are passing through ulcer and you have been on medication for years, months, and even weeks, yet nothing to show, all the symptoms, all the signs are still there, then this video is for you. Watch till the end. You will get help. If you are coming across my channel for the first time, welcome. My name is Ifechukwu Prudenciana Okachukwu. I'm a registered nurse, a midwife, and a family planning provider. I film health-related content, especially family planning and reproductive health. If this is the kind of content that you're interested in, keep watching. And please follow, like, comment, and share. And don't forget to subscribe to my YouTube channel at Nurse Prudence. Peptic ulcer is like a common name for 3 types of ulcer. Number 1, we have esophageal ulcer, we have gastric ulcer, and we have duodenal ulcer. Now, when the ulcer is affecting the esophagus, we call it esophageal ulcer. Then, when it's affecting the stomach, we call it gastric ulcer. When the duodenum, which is the first part of the intestine, is affected, we call it duodenal ulcer. But in common, it is referred to as peptic ulcer. All of them will call it peptic ulcer. Now, many people are passing through a lot: discomfort, heartburn, all the signs and symptoms, vomiting, nausea, everything. And they have been on medication for years, some months, some weeks. Yet, the symptoms are still there. Yet, no results, no effects, nothing. The question you ask yourself is, what am I taking and how am I taking it? It is common that some of us always take milk of mark. Some have gestate inside their pockets. They are taking it as if it's water. These medications are not really for the treatment of ulcer. Remember, ulcer is caused by a bacteria called Helicobacter pylori, right? Popularly known as H. pylori. Yes. So, when you are taking milk of mag or gestate, gascol, these medications cannot do nothing except to calm the intestinal mucosa or the gastric mucosa. It's just for a temporary relief from the discomfort, the heartburn. That is why some of them, within an hour, you will see yourself taking it again. You go over the counter to buy so many medication. After everything, you will still be passing through discomfort, the heartburn, and all the things you normally experience as someone that has ulcer. Self-medication is not good. Self-medication is not good at all. Please stop it. For people who have ulcer, we normally treat them with 5 classes of drugs. Ulcer is being treated with what we call combination therapy. Not 1, not 2, not even 3 in some cases. Now, the 5 classes of medications we use in the treatment of ulcer are: number 1, we use antacid. Example is milk of mag, which you people are common with. We have all this gascol or gestate. Yes. Then we have another class called antibiotics. Under these antibiotics, we have clarithromycin, amoxicillin, and we have metronidazole, commonly called flagyl. We have another class called H2 blockers. That is histamine 2 blockers. Example of this, we have cimetidine, ranitidine. All the din are under this class of medication called the H2 blockers. That is histamine 2 blockers. We have another class called the PPI. That is the proton pump inhibitors. Example is omeprazole. Yes. We have omeprazole, all the zoles or zo, they are under PPI, proton pump inhibitors. Now we have the fifth one called the mucosal protective agents. Example is misoprostol, we have sucralfate, and then we have bismuth subsalicylate. Example is Pepto-Bismol. And for you to treat ulcer, these 5 classes of medication has to be in play. You have to take them. Like, there's a way we combine it. Your doctor will combine it in such a way that it will suit you. Depending on the severity of your ulcer and other health conditions you may have or allergies, this will tell your doctor how to combine the medications. Some of you don't know this. All you know is that you have ulcer, these drugs they don't work, this and that, because you're taking the wrong medication and you're taking it wrongly. Now, there is what we call combination therapy in the treatment of ulcer. First, you combine 3 medications. Among these 3, we have 2 antibiotics and then 1 proton pump inhibitor. The 2 antibiotics are clarithromycin and amoxicillin. Then you combine it with 1 proton pump inhibitor, that is omeprazole. Now, in a situation whereby that the patient is allergic to penicillin, you will not prescribe the amoxicillin. Rather, you will now replace it in alternative. You will now replace it with metronidazole, that is Flagyl. And whenever you prescribe Flagyl, it means that the dose for clarithromycin will be reduced. All these things are what is supposed to put into consideration in the treatment of ulcer. But individually, you go over the counter, go to the pharmacy, chemist shop around you, you buy this, you buy that, drink this and drink that. And after you will say, it doesn't work, my ulcer doesn't go, I have tried for years, for months. This is because you are not treating it the way it's supposed to be handled. Go to the hospital and get yourself evaluated. Listen, let me try to explain all these things. What I'm trying to say in essence is this, that for you to treat ulcer, we don't treat it with a single medication. Only one medication cannot treat your ulcer. That is the point I'm trying to make. Be sure the type of ulcer you have, whether gastric ulcer, which is the one affecting the stomach, or the duodenal ulcer, which is the one affecting the upper part of the intestine, or the esophageal ulcer, which is the one affecting the esophagus. So it's not really about taking medication, going to the chemist to buy medication. The issue is which one is affecting you and what are you taking, how are you taking it. Now, for people who have gastric ulcer, the combination therapy I was talking about is they will combine it with the PPI. That is the proton pump inhibitor. Forget about the long name. This proton pump inhibitor, example of the medication is omeprazole. All of you know that. Then for people with duodenal ulcer, we normally go with H2 blockers, that is histamine 2 blockers. In this case, we have like cimetidine and ranitidine with other ones. Now, currently, cimetidine is not commonly used again. We are now using ranitidine and other ones. This is because of its interaction with other medication. So the rate at which cimetidine is used has been reduced. So the commonly used one now is ranitidine, which can be sold over the counter. Yes. So the issue is not about taking medication. It's about taking it the right way and the right time. So you cannot treat your ulcer only with one medication. It will not cure it. It will not go. And the duration also matters a lot. Most people can be on ulcer medication for 10 days to 14 days, depending. And even while on medication, the doctor will now, in addition, prescribe the antacid, and the mucosal protective agents. Don't worry about the names I'm calling. These mucosal protective agents are the medication that will help to soothe the gastric lining, that is the stomach lining, and give you relief from the pain, and will now help in healing even after the main treatment. Sometimes when you finish the antibiotics and the other medication, these antacid and the protective agents, you will still be taking them. This is to help you through healing. So it's not something that you can just buy over the counter. When you take this week, you stop. The next week, you buy another one. No. See your doctor and he or she will prescribe it for you. You know the right one to take and how long you will take it. Believe me, you will be fine. Stop taking it over the counter. That is the point I'm trying to make. If this video is useful to you, of course I know it's useful. Yes, please follow me, like, comment, and share. Very important. Share my videos, please. And don't forget to subscribe to my YouTube channel at Nurse Prudence, please. Until I see you again in my next video, please do take care of yourself and drink plenty of water.